Hair loss, it is a common problem for Americans, and not just for men. In fact, more than 35 million men and 21 million women suffer from hair loss. About 30% actually lose their hair by the age of 30. Dr. DJ Verrett is a hair loss expert. He's with us today to talk about some of the most common hair loss myths and some treatment options available. And let's start with the myths, because there are a lot of them out there.
There are a lot of them out there, absolutely.
One of them is it comes from, what, your mother's side?
Mother's side of the family. Look at your mom's side. And actually, that's incorrect. The major genetic cause of hair loss is actually what we call an autosomal dominant, so it can come from either side. And hair loss is actually multifactorial. So just looking at your mom's side isn't enough. Just looking at your dad's side isn't enough. But it gives you some idea.
What about, I've always heard, don't wear hats all the time.
It's another popular one. It has nothing to do with it. The thought is by wearing a hat, you cut off oxygen to the hair. Not true. However, some people that wear very tight hats for religious or cultural reasons can pull the hair right where the hat touches and cause some hair loss in those cases.
And then, of course, the using a brush instead of a comb.
Yeah, no, that doesn't matter at all. The thing to remember, though, is if you have knotted hair, you don't want to pull through the knots because that can actually pull the hair out and cause some scarring of the follicles. That can cause hair loss.
So that's true. The pulling out hair is never good, right?
Exactly.
Okay.
Exactly.
Well, let's talk about what are the 5 actual causes of hair loss.
Well, there are a lot of different ones. The most common cause overall is androgenic alopecia, or what most people term male pattern baldness. It also affects women as well. Hormonal abnormalities are very common in women. There are autoimmune diseases, which, again, more women are affected than men, but can affect both sides. Medications and certain psychological factors are actually diseases where people actually pull their hair out.
And I've heard of that. Yeah. Now, real quickly, obviously we know you can do the hair loss or the hair transplant.
Right.
But what are some non-surgical solutions?
Well, the thing with hair loss treatment is to catch it before it starts falling out, or right when it starts to fall out. Non-surgical treatments include vitamins. You want to make sure that your hair is well fed because it is one of the most metabolically active portions of the body. Rogaine or minoxidil, Propecia or finasteride are 2 medications which are FDA approved for hair loss. Recently, we've added Latisse to the arsenal, and Latisse is for women or men who suffer from eyelash loss. It's a very good product. All of those products, though, need to be used for several months. If you stop using them, the hair loss will simply come back.
Okay.
There's also another device called low-level laser light therapy, or the HairMax laser comb. It sounds kind of like voodoo.
Right, but we've done stories on it, and
yes.
I know they've had some success with that.
Absolutely,
yes.
And there are some very good studies out there, some real scientific studies, and the FDA has actually evaluated the HairMax laser comb, said that they can actually advertise that they do help to stop hair loss.
So a lot of breakthroughs. Well, we appreciate you being here very, very much.
Well, thank you.
And I know this is just the tip of the iceberg. We'll have to revisit this again.
Absolutely. Lots more to know.
Yeah, a lot of people are very curious, and we'll have, again, Dr. Verrett, if you have any questions, you can always contact him.